Hello, good morning. I'm Jayashree Gopal. I'm an endocrinologist working in Chennai. Today, I'll be sharing some tips on how we can avoid diabetes. November is known as Diabetes Awareness Month. More specifically, November 14th is known as Diabetes Awareness Day. Why did all this come about? Why are we so concerned about diabetes? It is because of the sheer burden, the global burden of diabetes. If we look at the numbers, about 116 million people in China are estimated to have diabetes, and close to about 80 million in India, and 20 million in a small country like Pakistan. So the whole world is suffering from diabetes. And to put it in perspective, if you look at the number of people worldwide who have suffered from COVID-19 as of today, November 27th, it's close to 260 million people. And as of this year, it is estimated that worldwide close to about 240 or 250 million people have diabetes. The only difference between COVID-19 and type 2, both are on a pandemic scale, is the time frame. COVID-19 has hit us hard in the last 1.5 to 2 years, whereas type 2 diabetes has been going on for a while. We're also worried about diabetes, not only about the numbers, but about the complications that it causes. A lot of people who die of heart attack or stroke do so because they've developed it because of diabetes. Similarly, the leading cause of blindness worldwide is diabetes. Again, the most common cause for developing renal failure is diabetes. A very common cause for foot amputations is developing infections in a person with diabetes. So diabetes is associated with a lot of complications. And though we have developed a lot of therapies currently, which are very useful in controlling diabetes and preventing complications, if we can prevent diabetes from occurring in the first place, that would be the best. What causes diabetes in the first place? And that is something called insulin resistance. Insulin is a hormone that is made by this little fleshy organ present in our stomach called the pancreas. And it is the central hormone in our metabolism. What normally happens is if your pancreas is working well, every time you eat, your body makes insulin. Now, the amount of insulin your body makes depends upon the carbohydrate content of what is going in. But irrespective of what we eat, in general, our body makes insulin after a meal. This insulin binds with something called the insulin receptor, which is present on every cell in our body. And insulin is like a lock. The insulin is like a key, that opens the lock and lets glucose enter the cell. Once the glucose enters the cell, it is broken down, metabolized, and used for energy. In what is called type 1 diabetes, the body does not make enough insulin. Therefore, glucose cannot enter the cell. In what is called type 2 diabetes, though our body makes a lot of insulin, it is not able to open the lock. The key does not fit the lock, and that is referred to as insulin resistance. So again, glucose cannot enter the cell. So there is a lot of insulin floating around and there is a lot of glucose floating around, but the glucose cannot enter the cell. What we do know about insulin resistance is that it tends to happen more often in people who have excess body fat, particularly excess body fat in the tummy area. And that this insulin resistance and developing diabetes is responsible for causing heart attacks, strokes, and deaths. So before I talk about what is this association between insulin resistance, abdominal fat, I want to take you through the story of the 6 blind men and the elephant. I think all of us have heard about it. So it is a story that talks about how 6 blind men came across an elephant. And depending on which part of the elephant they were able to touch and feel, they described the elephant in 6 different ways. So the person who felt the side of the body of the elephant described it as a wall. The person who felt the ears described it as a fan. The person who felt the tusks said that the elephant is like a spear. The person who felt the trunk of the elephant said it's a snake. The person who felt the leg said it's a tree. The person who felt the tail said it's a rope. But they were all describing the same thing, the elephant. Now, what am I referring to as elephant? The elephant I'm talking about is the occurrence of the most common cause for death worldwide, which is a heart attack or a stroke. And for a long time, researchers and scientists knew that heart attacks and strokes occurred because of high blood sugars or high blood pressure, or because of thickening of the blood vessels, or because the blood tended to clot too easily, or because of high cholesterol, and because of a condition called inflammation, which is like a slow fire in our body. So scientists knew for a long time that all of these things led to heart attacks and strokes. Over the last 15 to 20 years, it also became clear that this heart attack and stroke was also somehow related to excessive accumulation of body fat, particularly in the tummy area. And this excessive body fat in the tummy area was also associated with the same things that were causing the heart attack and strokes. And then it became clear that this accumulation of fat in the tummy area was associated with insulin resistance. And this insulin resistance was what was actually causing the heart attack or the stroke, because this insulin resistance led to inflammation, which then increased risk of heart attack and strokes. So it's the same, if you get down to the heart of a lot of chronic diseases, the inflammation due to insulin resistance is what is causing a lot of chronic diseases, including not only heart attacks and strokes, like I mentioned, but also a lot of cancers, particularly breast cancer and lung cancer. Arthritis and joint pains, which afflicts a lot of older people, is because of the same inflammation, again, occurring because of excess body fat around the tummy area. Skin conditions like psoriasis, conditions like irregular cycles, which tends to affect young girls and due to something called polycystic ovary syndrome, infertility among young women. All of this, if you trace it back, is in large part due to this underlying insulin resistance and inflammation. The reason I gave this sort of long preamble is because I want to reiterate the importance of avoiding this insulin resistance. If you avoid insulin resistance, if you get your body's insulin to work properly, you can avoid a lot of chronic diseases. So what causes insulin resistance in the first place? What is the cascade of events that leads to insulin resistance? Of course, we are familiar with a few things, what I have mentioned earlier: accumulation of fat in our bodies, particularly in the tummy area. So you don't need to be very overweight. Even gaining about 4 to 5 kilos of weight around the tummy area can cause insulin resistance in people who are susceptible because of their genes or their hereditary component. So if you, let's say, have your parents who develop diabetes at a young age, say in your 50s or 60s, relatively young age, and you have also gained weight by the time you're in your 30s, you've just gained weight a little bit, about 4 or 5 kilos around your tummy areas, but because of this genetic susceptibility, you are also prone to developing diabetes or heart attack or stroke or cholesterol. Lack of exercise is a very important factor in increasing insulin resistance. Lack of proper sleep. And I want to spend some time talking about sleep because it is so important to avoid insulin resistance, and excessive consumption of carbohydrates. And any other chronic illness which can cause inflammation will also increase insulin resistance and ultimately lead to a lot of the chronic diseases. So how do we maintain our good insulin sensitivity or good insulin action and avoid insulin resistance? Of course, one important, very important factor is to avoid weight gain. And we can avoid weight gain by eating healthy and sleeping well. So talking about sleep, it is a common misconception that the more you sleep, the more obese you become. That is not strictly true. In fact, what has been found is that when you sleep less and you don't sleep at the proper time, that is associated with actually gaining weight and developing diabetes. So it is important that we sleep for the proper period of time. How much of sleep is good enough for us? Most people require between 7 to 9 hours. In general, when you're younger, you need more sleep. The older we get, we need less sleep. Particularly children between the ages of, say, 12 and 19, the so-called teenage years, tend to sleep a lot. And it's not because you're lazy, it's because your body needs that sleep. It's only when you're sleeping that you're growing. So in general, most children between the ages of 12 to, say, 18 years would need about 10 to 12 hours of sleep every night, ideally. However, because of the pressures of, say, your social activities or because of exams, A lot of times children miss out on this much needed sleep. Timing of sleep is also important. It's important that you go to sleep when it's dark outside and you wake up when it's light outside. Our body undergoes a lot of hormonal changes when it starts getting dark outside. When the sun starts going down, certain hormones start being made. And when the sun starts coming up, certain other hormones start being made. If we do not follow this circadian rhythm that our body needs to get accustomed, if we do not do that, if we go to sleep when it's light outside, you've stayed up all night preparing for an exam, or you've been out and you come back and you go to sleep at say 4 o'clock or 5 o'clock in the morning and wake up say midday. If you do this consistently enough, that is going to play havoc with your insulin action and increase insulin resistance. So it's important that you get sleep at the proper time. Unfortunately, what is happening through the years is that worldwide, most people are getting less sleep. So on an average, while in the 1950s, people were sleeping between 8 to 9 hours. Currently, it is estimated that worldwide, most of us are only sleeping for about 6.5 to 7 hours. Why is this important? Because studies have shown that even losing sleep for 4 nights in a row. So this was a study done where they took young men who had absolutely normally working insulin, no diabetes, and they made them sleep deprived. They said for 4 nights, you need to only sleep for 4 hours. And what they found was that even at the end of this 4 nights of reduced sleep, they had a significant increase in their insulin resistance, as evidenced by the production of free fatty acids and as evidenced by the fact that their growth hormone secretion was much less. So growth hormone is another hormone that is important for growth, obviously, but it's also important to keep our body's insulin working properly. So even losing 4 nights of sleep increases insulin resistance. So it is important that we get enough sleep and that we get that sleep at the proper time. And this is a very important factor in preventing a lot of chronic diseases because of that insulin resistance. The other important aspect of sleep is that we need to avoid exposure to light at night. A lot of times when we are studying, staying up late, studying for our exams, we are exposed to light from the various devices that we are looking at, either because a light is on in the room or because we're staring at a computer. And exposure to light at night has been shown to be associated with increased risk of heart attacks, cancers, obesity, diabetes, depression, and reduction of your immunity. So exposure to light at night is also not good. So not only is it important to sleep for 7 to 9 hours, it's also important to sleep when it's dark outside and wake up when it's light outside. What is a healthy diet? What I think is a healthy diet is a no sugar, low carbohydrate. Eat as little carbohydrates as you can. You do not need to eat much carbs. A moderate amount of protein, particularly in your growing years, because you need the protein to build up your muscle and your bone and various organs. High fiber, you need to eat a lot of vegetables, and you do need to include good amounts of good fat in the diet. So don't be afraid of fat. Fat is not a bad thing. Good fat, whether it comes in from, say, things like oils or ghee or fats which come into our body from nuts, is very good overall for our metabolism. So a healthy diet should be no sugar, low carb, moderate protein, high fiber, and don't be afraid of good fats. We need to keep moving. A big risk factor for developing insulin resistance is our sedentary lifestyle. Sitting is the new smoking. You must have heard this phrase many times. Our bodies are meant for movement. We have to keep moving. Make sure that we are getting at least about 8 to 10,000 steps in a day. Even if you're not exercising, make sure that you're getting in at least about 10,000 steps in a day. And also, it does not matter if you worked out intensely for an hour in a gym and the rest of the time you're just a couch potato. That also doesn't help. So you have to keep moving constantly. Apart from exercising, keep moving. And as we get older, we need to make sure also that we maintain the flexibility of our joints. So one of the things that happens with insulin resistance and inflammation is that our joints become stiff, which is why a lot of older people tend to have difficulties moving around, sitting up. So from a young age, maintain the flexibility of your joints. Drink lots of water. That's a very important aspect of the diet. One other very important aspect or a risk factor for developing diabetes is being over clean. So if we keep on Of course, it is important that we maintain hygiene and cleanliness, but there is a limit to it. As with everything else, it has to be in a balance. If you are too dirty, it can cause diseases, but we are over clean, also it can cause disease. And this happens because of two main reasons. When we keep on, say, exposing our body to toxic chemicals and killing off the good bacteria that live in our body, we are setting ourselves up for many chronic diseases. The microbiome, our body's microbiome, or the bacteria that lives in our body, is a very important aspect of our health. It is a very important aspect of our metabolism. The bacteria that's living in our intestine helps to maintain good metabolic health. So the microbiome is a very important part of us. Yes, have a bath every day, but don't be overzealous. Don't have a bath 4 times a day. Yes, it's important that we maintain clean environment, but exposure to our environment, exposure to a little bit of dirt is good for us. It builds up our immunity. So it has to be in balance. The other drawback of being overzealous about cleanliness is that we get exposed to a lot of toxic chemicals like pesticides and cleaning agents and antibiotics. And it's been estimated that exposure to pesticides increases risk of diabetes by 60%. And using antibiotics more than 5 times a year also doubles your risk of diabetes. So exposure to too much of these chemicals is also not good for us. Because of something, these chemicals that we are exposed to on a daily basis disrupt our hormones. There is a whole category of chemicals called endocrine disrupting chemicals that are widespread in the environment that affect our hormonal balance. And they mimic the hormones that are present in our body, and they prevent these hormones from working properly. How do we know that we're getting exposed to these endocrine disrupting chemicals? These are all common things in our environment that may contain one type of an endocrine disrupting chemical called PFA. There are many, many types of endocrine disrupting chemicals. And in fact, the Endocrine Society has come out with a guideline talking about what are all the chemicals that we get exposed to and what is the research that has gone on regarding these chemicals and the diseases that they cause. But for example, frequent usage of non-stick pans, baking paper, cosmetics, pizza boxes, food containers. So try and minimize the exposure. Of course, avoiding junk food is important, but for example, as soon as you get your pizza, take out the pizza while it's hot. Don't let it remain in the box for a long period of time. Similarly, if you're going to use, don't heat up things in a plastic box in the microwave. Take out the food item, keep it in a ceramic plate or a glass plate before heating it up in the microwave. Don't be overzealous about using cleaning products. Water, simple soap is good. So there are a lot of things that we can do to minimize this exposure to endocrine disrupting chemicals. So finally, I just want to finish by saying, if we avoid weight gain, exercise regularly, keep moving, sleep well, sleep for a proper duration, but also sleep at the proper time, avoid exposure to light at night, eat healthy, make sure it's low carb, high fiber, moderate protein, try and avoid exposure to toxic chemicals, we can maintain insulin sensitivity and hormonal balance. I hope you found this talk useful. And if anybody has any questions, that's my email over there. And I'm happy to answer any other questions or concerns or give you the links to a lot of the studies that I have been quoting. Thank you very much. And good luck, Hiranya. I hope this reaches a lot of people and we can create more awareness about diabetes and how we can prevent diabetes. Thank you.